Hello, my name is Veronica. I'm Professor of Child and Family Health from the School of Healthcare in the University of Leeds. In this short talk, I'm going to talk about some of the research that we do around the challenges that children and young people living with long-term conditions and their families have in learning to manage the complex aspects of their care. Because most research areas that we investigate come from practice, we work very closely with families and with practitioners as we develop research and as we take the research results back into practice to try to improve the experience for children and families and parents. In this short presentation of slides, you'll see on slide 3 an overview of the members of the research group, the Child and Family Research Group, and some information on the type of research that we all do. And as you'll see, we all focus on a different aspect of long-term condition management. In the rest of this talk, I'm going to focus in particular on the very complicated aspects of clinical care that many children and young people and parents have to cope with when they're at home. And you'll be able to see examples of some of these on slide 4. And as you can imagine, this presents a lot of challenges for the families. And as more and more complex care is delivered in the home and in the school and in the workplace, this presents real challenges for the families but also the health professionals. There are issues such as literacy and numeracy and language that make it difficult often for healthcare professionals and families to communicate the best way to give complex care at home. In order to support our research, therefore, we need to know what the literature says. We need to know what previous research has been done in this area. So we've done some reviews, some systematic reviews of the literature, and we've also drawn on systematic reviews from our colleagues in other centres and in other countries. So you'll see from slides 5, 6 and 7 what some of the challenges are from the children and families' point of view and what the evidence tells us about the challenges for families and health professionals. To help to illustrate some of this work that we're doing, I'm going to talk a little bit now about a project called the Online Parent Information and Support Study, otherwise known as the OPIS study. This project is a project that developed with parents and with health professionals a web resource to help the parents to learn to manage some of these complex aspects of care at home. And it was important to do this because there's a lack of evidence-based, user-led web resources out there. There are many, many web resources out in the world, but these tend not to have been developed rigorously and systematically and are not necessarily up-to-date and reliable. Therefore, if you look at slides 10 and 11, you'll see an overview of our project and the design that we use. So, in summary, it was a mixed method study and it was very collaborative. We worked using a co-design principle with children and parents to develop this resource that was intended for parents. And on slide 12, you'll see some of the features of this and some of the benefits that the families found from using this, and benefits that often help professionals as well. On slides 13, 14, 15 and 16, there are some snapshots of the finished website and examples of some of the pages of information that were provided. This resource was very interactive and there were resources that were developed for children of different ages as well as for parents. And this was so that children could learn about their condition with the help from the parents, but many of the parents also told us that they found that the children's resources were very useful for themselves. On slide 17, you'll see an overview of the third part of our study, which was a feasibility randomised controlled trial, which we did to try and help us to design a full trial in the future. And as you'll see from slides 18, 19, 20 and 21, the results are quite interesting, and we were able to learn from the results that OPIS did in fact help parents to feel more competent about managing their conditions at home, and we also got a lot of useful feedback on how we could change the presentation of the resource and the way it it functioned for the different users on different types of devices. And we got some qualitative suggestions as well as quantitative suggestions. And based on these, we made some recommendations, and this included that bespoke versions are needed for children and young people and parents, but that these need to be developed to be used on smartphones and not just as a web resource. And this is because obviously technology is moving on and more people are routinely using smartphones. So in conclusion, we decided that OPIS really was feasible to implement into standard practice based on our results, and in fact it is now standard practice in the hospital where it was developed. We also realised that our design and methodology that we'd used could be used as a platform to adapt OPIS for future use, including for a smartphone app. And we're now seeking funding to develop a smartphone app that would be suitable for children of different ages and developmental stages. So this will have a number of different pages that will be relevant to children from different ages, and pages for parents, including parents who may need their information translated into different languages. So as a result of this work, we're continuing to develop future work around this area, and all of these findings are implemented in practice as and when we get results and evidence to show that they're effective. And so this completes the circle of from practice to research and back again. So thank you for listening. I'd just now like to acknowledge the children and parents and professionals who took part in our work in a number of different projects, including the OPIS. I'd like to acknowledge all the members of the research teams. We've got people from practice and from universities around the world, and this has really helped to strengthen this work. And we'd like to acknowledge the funders as well, who funding enabled us to contribute to this important area of work. And finally, on the last slide, there are some references to some of the resources that we've mentioned here, if anybody would like to find out a bit more about the work we're doing. Thank you for listening.